high-quality pre-analytical handling of all specimens and nuanced interpretation are essential. Recent development of powerful new drugs, for example, the HER2 antibody-drug conjugates, has shown efficacies in tumor that are HER2-low or even ultra-low.
Hello, and welcome back to the Oncology Brothers podcast. Today, the topic at hand we'll be tackling is HER2 testing in breast cancer space. What used to be rather binary classification that is positive or negative has rather evolved into significantly something more profound. That is, what we're using for HER2 status being reported as positive, negative. Now we are also reporting that as positive or low or even ultra low.
It is important to appreciate the shift and these nuances in testing because HER2 has now become not just a classic oncogenic driver, but also a target for antibody-drug conjugates such as trastuzumab deruxtecan.
A number of different new biomarkers have emerged. They do have a significant impact in the way we manage patients and we select treatment.
So it is crucial to test for HER2 expression in breast cancer. We can look for the gene amplification by doing in situ hybridization. The other way to do is to look at HER2 protein expression by immunohistochemistry. So by looking at this, we score the tumor cells expression from 0 to 3+. Only 3+ strong staining correlates with gene amplification and thus considered positive. And for cases that are scored 0, but they show very, very weak staining, we call this HER2-ultralow.
Because some of the new therapies, for example, in the DB06 trial, also work in patients that are not HER2 3+. They also work in 1+ and 2+, and in the ultra-low.
Pre-analytical errors usually would lead to reduction of the antigen expression, and thus it would lead to false negative results rather than false positive results. So this is particularly important in HER2-low, ultra-low setting, because when they are already very low, if you lost your sensitivity, then it will become decreased from ultra-low to negative.
So I think that the critical key message is that we need to recognize this complexity, the understanding of the disease, the resistant mechanisms, actually leads to one very important concept. We improve patient outcomes.